My name is Adler Dillman. I am a professor at UC Riverside and department chair for the Department of Nematology, and I have been a member of the UCR community for 9 years. So this is a multi-tube rotator, and we use this to agitate a variety of solutions to keep them happy. Many times when we work with nematodes, they're fine in aquatic solutions, but sometimes the organisms or the solutions we work with need to be agitated. Nematology is the study of microscopic worms. Many of these worms live in the soil, but they also live in marine and freshwater environments. I study parasites, but there are many nematodes that are not parasitic. In January of 2023, I received a call from a veterinarian in Los Angeles County concerned about a number of cases they have had of canine schistosomiasis. This is a disease that's caused by a flatworm, sometimes referred to as a fluke. And what was so striking to her about these cases is they'd had 11 cases, all in Southern California, and none of the dogs or their owners had been out of the state of California. So they were concerned about maybe there being a local source of origin for this parasite, and they asked if I would help them. Sure enough, we went to Blythe, California, which is on the Colorado River, and we collected hundreds of small snails, not microscopic, but a few centimeters. So small, you might overlook them. This is a necessary intermediate host for the parasite that causes canine schistosomiasis. And sure enough, we did find that some of those snails were carrying and in fact shedding the stage of the parasite that can infect dogs. When it infects a dog, it causes disease in the liver, in the spleen. It can cause problems in the lungs and in the heart. And ultimately, if the dog isn't treated, it can die from this parasitic infection. And previously, it was not known to be present in California. One of the most powerful things you can do to keep your dog safe is knowledge, knowing. And as long as we know what's out there, what's possible, your dog can be protected. For example, with this canine schistosomiasis, knowing where the parasite is provides some level of protection. You can decide that you don't want to let your dog in certain bodies of water, knowing that there is a risk. Or if you do decide to take that risk, if your dog shows symptoms later on, then you can go to your vet and you can tell them your dog has likely been exposed to this particular parasite, and diagnosis and treatment can be obtained.